Today's session is on mitigation and adaptation, as I already mentioned. And here's just a reminder of the schedule in this course. So we're now in module 4. Today is the 18th of April, so we'll take actually 90 minutes, sorry, that's a mistake, to complete the session, so an hour more. And then the final session will be held on the 9th of May. So we've changed the date of that. Apologies if that causes any inconvenience, but we thought that because in this session, we'll give you another homework to work on, you may benefit from a bit more time rather than just a week as it was according to the last schedule. Here is a reminder of the intended learning outcomes for the whole course, which you're all very well familiar with by now, so I won't dwell on that. We've covered the last presentation and the question on teamwork. And so today's learning outcomes are on identifying and assessing different mitigation and adaptation strategies that can help us deal with environmental change and non-communicable diseases. But it's also to recognize the different ways how we can go about developing solutions. So skills like systems thinking, transdisciplinary collaboration, engaging stakeholders, how do we actually innovate? How do we create new solutions? And how do we achieve transformative change? So that's what we will talk about today. And you had for the session a number of readings, quite a large number of readings. So I hope you've had a chance to look at some of them. You had a set of readings on different frameworks for developing environmental and health indicators, including deep sea and others. So consider that more as a deep dive set of readings. If you're interested in the topic, there are different perspectives on how these frameworks can be developed, and I hope it will be useful for you to go through some of these readings when you come to developing sort of smart health indicators and liaising with the stakeholders and finding out what information is useful for them about our interventions and environmental and health issues in the free study countries. Then you had readings on sort of the overall landscape of research on climate and health, and Leah's Baring-Ford's paper, which mapped what's the state of research on climate and health. That gives you an overall picture of where we are with the research and what's the balance between different areas. Then you had 2 chapters from IPCC, one on adaptation and one on mitigation. I think in one of the chapters I suggested specific sections, so if you could skim through those, that would be great. And then correspondingly, you had 2 kind of review type of papers, report type of papers. One was on adaptation actions and public health connections of those actions, which was a systematic review. And then there was a report by the Pathfinder on mitigation actions and their health co-benefits. So that gives you more of a perspective of where research is at with these topics. But why are we talking about mitigation and adaptation? So you may have already seen these climate stripes developed by Ed Hawkins, and these climate stripes, essentially every single stripe indicates what has been or what is projected to be the temperature in each year historically, and here's where we are now, and what it's likely to be in the future. And you can see that now we're at a point where we can choose what future we actually follow. Do we follow a future of high warming or low warming? So how do we address the issue of climate change? And I guess similar graphs could be drawn for other environmental changes, maybe with slightly different environmental indicators that won't be temperature for all, but other parameters. But that's just to illustrate sort of that we have the choice now, and now it's up to us about how do we take our future forward. And based on the climate stripes, IPCC developed this very helpful diagram that shows sort of the specific scenarios, so very high emission scenario, intermediate, low, and very low, and what the temperatures are likely to be. And what they did also, they mapped out what those temperatures will be for people born in different years. So if we think about people born in 1950s, they would be sort of around the age of 60 now, and that's the current level of temperatures and warming that they've experienced, which is on average about 1 degree warming. People born in the 80s, by the age of 70, they will experience higher levels of warming. And you can see that every person is split into these emission scenario levels. So that's the kind of gradient of choice that we have. And of course, a child born in 2020 would experience much higher levels of heat by the age of 70, but they will also be experiencing very high levels of warming already earlier. So that's just to illustrate the scientific basis for what's to come. So our choices kind of for climate change is mainly for in terms of mitigation and adaptation, the two sets of actions that can be broadly taken. So adaptation is about how do we tackle the environmental changes that are already occurring. So how do we minimize our risks? How do we prevent ourselves being affected by the changes that are happening? How do we sort of protect our health? And mitigation is about how do we actually tackle the changes themselves? How do we reduce greenhouse gas emissions? How do we reduce the drivers, pressures, etc.? And how do we heal our environment, in other words? Most frequently, these two terms are used for climate change, but they could be used also for other environmental changes. And the rest of the session and material that I will be presenting is taken from climate change because that's where mitigation and adaptation so far has been discussed most. But again, similar thinking can be applied to other areas. So in other words, you can see that adaptation is managing the unavoidable, and mitigation is about avoiding the unmanageable. And you can see some examples of what that is. So adaptation could be about flood protection, building design, disaster management, while mitigation is about how do we reduce our emissions, so using renewable energy, energy efficiency enhancements, using sustainable transport, etc. And then in the middle, we also have a set of actions that actually are both. They're both contributing to mitigation and adaptation. And typical examples are improving our forests, creating green infrastructure in cities, managing water and energy better, etc. So it's actually rarely a clear-cut distinction between adaptation and mitigation. Many actions are really together. They're sort of in the middle and they interact. It's kind of preferred to always talk about adaptation and mitigation together rather than separately. So people shouldn't really be treating them as a choice, but rather trying to integrate both. So if we think of adaptation first, here is an image from the previous, not the latest, but the previous IPCC report, which is helpful in a sense that it shows you the different health impacts of climate change. And it also shows you what that health impact would be in terms of the global magnitude if we used high adaptation, which is the yellow bit in each of these diagrams, and what it would be with sort of fairly kind of achievable if we didn't implement fairly achievable adaptation. So essentially, this is quite easy to adapt to, and that's really hard to adapt to. And that's shown for different stages. So I think that's for the present, that's 2030 to 2040, and that's 2080 to 2100. And that's the progression of the health risks. So you can see that to some of the risks, we can adapt better than others. And unfortunately, for most of the risks towards the end of the century, there will be a fraction of risk that's really hard to adapt for, which is why many people talk about something that's called limits to adaptation. And limits to adaptation can be soft and hard. So soft limits to adaptation is where adaptation hasn't happened yet, and it's maybe something that people haven't committed to yet, but it could be achieved if, for example, financing was allocated, or there was political commitment to implementing adaptation or something else. So these soft limits can be overcome. But then the hard limits is something that we actually would really struggle with getting over. So hard limits would be temperature increase already is really high, and there's very little we can do about adapting to it substantially. The same goes for the coastal communities. If they're threatened by sea level rise, there's actually very little we can do to reverse that. So the hard limits is what we should be trying to foresee earlier on, and that's what we should be essentially acting on with mitigation, because that's the most effective solution to anything that's beyond the hard limits of adaptation. What can also happen when you're adapting is that you can produce a very successful adaptation, which sort of ticks all the boxes for health, for the environment, for equity, etc. But you can also maladapt. So you can adapt in some ways, which is looking effective in the short term, but actually produces some poor outcomes in the long term, or it can benefit one aspect, but actually produce negative consequences for other aspects. And here, authors of a Nature Climate Change paper have created this kind of conceptualization. How do you assess whether an adaptation action is actually adaptation, successful adaptation, or is it a maladaptation? And you can see that they've used these number of criteria. So, for example, the number of people that the adaptation action is benefiting, is it small or large? Is anyone outside of the target community also benefiting or not? What are the consequences for the ecosystems, for emissions, for kind of systemic change? And what are the equity considerations? And you can see that they've assessed a number of adaptation options according to these criteria, and you can look at this later in more detail, but you can see that some adaptation options like coastal infrastructure building is actually more of a maladaptation rather than a successful adaptation in many settings. But diets and sort of tackling food waste tends to be more of a successful adaptation. So all the sorts of actions that we're considering as adaptation, they can be more or less successful, and it's very contextually dependent. So in one context, it can be more successful than in another. So that's always useful to think of how successful your adaptation solution would be according to all range of comprehensive criteria. Another helpful concept that we should be considering when we're talking about mostly mitigation actions, but you could also use it for adaptation, is the co-benefits. So if we are, for example, mitigating climate change, we can also improve health, not only by reducing the risk of climate change and the negative impact that it creates in the long term, but also benefiting human health now somehow indirectly. So examples are active transport. So if you're cycling to work, you're not using car, you're using less fossil fuels, you're in fact contributing to the noise reduction in the city. You're potentially also reducing heat in the city. And using less fossil fuels, as I already mentioned, but you're also benefiting your mental health, you're benefiting your cardiovascular health, and probably lowering your rates of obesity. And these are the benefits that are occurring already kind of now in the short term within the lifespan of the person who is taking the action. It's kind of quite encouraging for people to think of mitigation producing not only these very long-term benefits that, you know, a policymaker who's making a decision on mitigation now isn't necessarily benefiting from fame or anything in the long term when they reduce climate change, but they are benefiting for sure from these co-benefits that they are achieving in the short term. So it's co-benefits is often used as a motivating factor to encourage people and policymakers to mitigate climate change, because there's not just the long-term benefit, but also something that happens in the short term and they can take credit for. And you can see that there are other co-benefits like eating less meat, has co-benefits for human health, increasing consumption of vegetables, improving air quality, and a few others. But in an equal way, you could think of co-benefits for adaptation, maybe a bit less directly, because adaptation kind of benefits health more in the shorter term as well, because it reduces the risks of climate change impacts sooner than mitigation. But you could, like, for example, design an adaptation strategy that also has some sort of a livelihood or income component, that while people are participating in an adaptation action, they're also actually benefiting their own livelihoods and improving their health or income or access to healthcare at the same time as they're helping that adaptation goal. So co-benefit argument could also be used for adaptation if it's carefully crafted. And I've mentioned before that adaptation and mitigation, they're actually quite closely interconnected often. And there are different ways how they can be linked. So adaptation can lead to mitigation. Mitigation can lead to adaptation. and I'll give some examples shortly. But there can also be synergies between them. So in fact, if you're using both adaptation and mitigation, they can produce an effect that's greater than just the individual effect of these actions. There can also be trade-offs. So sometimes you have to decide. You may have limited resources that the two actions can be allocated. So it's not always just kind of synergistic and mutually beneficial, but there can also be challenges. And many mitigation and adaptation actions can also be complementary. And people often try and think about how do we combine these different actions so that we can optimize the benefits for, let's say, health or for livelihoods or for other goals. So this optimization is almost like an approach, and you can do optimization modeling to select the right solution so that it benefits your outcomes best. And here are some of the examples to these different interactions between adaptation and mitigation. So for example, if you start with an adaptation action and you start considering it in the policy context, then you can become aware of the limits to adaptation, and then that awareness motivates negotiations on mitigation. Or you could be implementing an adaptation action like air conditioning, which is actually reducing your ability to mitigate, or because you're releasing more greenhouse gas emissions. Air conditioning is dependent on electricity, and depending on where the electricity is coming from, you may actually be disbenefiting mitigation through adaptation, but with air conditioning. In a similar way, mitigation can lead to adaptation action. So, for example, the clean development mechanism that was around some time ago, and the mechanism essentially gathered funds from kind of mitigation-related activities, and those funds could be directed into adaptation activities. Or community carbon sequestration could also kind of benefit livelihoods, similar to what I mentioned before. So other examples, so you could have like an assessment of the costs and benefits for mitigation adaptation in sort of achieving stabilization, and both are benefiting the same goal. So that's an example of synergy. And then you could have trade-offs. So local planning authorities may struggle to decide what to allocate land for an activity that's related to adaptation or mitigation, because land is limited, and so that leads to a choice between the two. And this diagram is taken from the first systematic review that was on your reading list about the overall kind of area of research on climate and health. And it shows just how much research there has been done on impacts and how little research there has been done on adaptation and mitigation compared to impacts, which is a huge imbalance. And many funders now are trying to direct their funding towards specifically adaptation research and mitigation research, and reduce funding availability on the impact research. And you can also see that there's lack of balance between research coming from low or high income countries. So high income countries produce a lot more research in this area than low income countries. And the map also shows you some of the gaps specifically. So for example, when we're talking about adaptation, a lot of literature on adaptation concerns extreme events, and there's less literature on adaptation and sort of non-communicable diseases, for example. There's also literature on mental health and climate change, which is mostly coming from developed countries and mostly from North America. Literature on mitigation is hugely predominated by air pollution research, but sort of other areas of health co-benefits of mitigation have been researched far less. So this graph comes from the a systematic review or a systematic map on adaptation research, and you can see what adaptation actions have been researched in relation to public health specifically. And you can see that, for example, ocean acidification has been least linked to various health outcomes. But on the other hand, extreme precipitation and extreme events like droughts have been researched in relation to health quite a lot. So has been heat. So you can see there's some imbalance there in the amount of research that's happening across these areas. And non-communicable diseases, as you can see, has been actually linked to adaptation actions in a very small section of literature. So most of the researched health outcomes were like food security, infectious diseases, and some of the others, but health systems and non-communicable diseases are hugely under-researched in relation to adaptation. And this graph comes from the Pathfinder report on co-benefits of climate change mitigation. So you can see again where the imbalances lie. We have a lot of research on co-benefits of mitigation in the diets, for example. We have a lot of research on co-benefits from mitigation activities in the transport sector. And we have very little on co-benefits of mitigation in industry, in agriculture, from clean cook stoves, buildings, etc. And you can also see actually how crude the health outcomes are when co-benefits are estimated. So usually what the studies focus on is overall mortality, years of life lost, and DALYs, and like far less of that is really kind of down to the specific health outcomes. So just differentiation by health outcomes largely missing from the literature as well. And it doesn't mean that if you see that there's less research in one area, it doesn't mean that there aren't healthcare benefits. It's just that we know less about them, unfortunately. And it's an opportunity for many of you as early career researchers to maybe focus on those less researched areas and try and contribute to them, because it's easier to produce noticeable research in an area where there's less research. And the more you focus on the areas where there's already a lot of research, the more intricate your research has to be, the more innovative it has to be, the more methodologically rigorous it needs to be as well. And so this graph also comes from the Pathfinder report, and what it shows is the difference in the effectiveness of different actions in relation to climate change mitigation and health. So you can see that some actions are a lot more effective in terms of climate change mitigation than others, and so it applies for health. And there's typically a pattern that actions that are really good for mitigation are performing less well on the health side, and actions that are really good on the health side are less good on the mitigation side. They're still effective, but it's just less of a benefit. So that's what comes from the literature. But I must admit, this literature is fairly limited, and there's definitely not enough studies there. Most of the studies are modeling studies, and very little is really kind of evaluation of actions that have been implemented on the ground. And when you model effectiveness of an action, you take so many assumptions that you don't really kind of report what would it be when the action gets implemented on the ground. So it's hugely important to do research on what has been implemented in practice and to evaluate it properly. But then, so how do we actually evaluate mitigation and adaptation? So you would be aware of many different study designs, so controlled comparisons before, after, time series designs, interrupted time series designs, all sorts of quasi-experimental designs, randomized controlled trials, etc. You could take any study design that's considered robust, but the important thing when it comes to mitigation adaptation is to make sure that what you're comparing is not just a generic sort of health outcome, but the specific health outcome that's attributable to the pathway between environmental change and health. So, for example, it is an adaptation action that you're evaluating. It's important to establish this attribution of the health burden before or after your action or without the action that is linked to the environmental risk, and compare it with the similar burden that's again attributable to that environmental risk after the adaptation action was implemented. And the same goes for mitigation. So you would need to think through the pathway. So how is that healthcare benefit related to the mitigation action. And for mitigation actions, you would also need to think of, well, what is the reduction in the environmental impact and how do you assess it? And you've had sessions from Erasmus on environmental impact assessment and the life cycle assessment, which are methods that can be used to estimate, so what was the impact on the environment? And equally for adaptation, you could evaluate, so what's the change not just in the health factors, but also in these environmental risks. So that's sort of an area where it's very helpful to think of the deep sea framework, which we looked at before, and try and see sort of what do you need to link with what to be able to produce a good quality evaluation. And then, of course, you can have both process and impact evaluation. What I spoke to you about just now mainly relates to impact evaluation, but you could also assess the process. And you can also monitor for, well, you should really monitor for unintended consequences and see how sustainable that adaptation is, how long people are using it for. And you have the word etiology at the bottom of the slide, which just means that we really need to think about the causal linkages. So how is that reduction in the outcome that we see because of the adaptation and mitigation action really related to the environmental factors? And now the question is, how do we actually implement actions that are at sufficient scale and at sufficient level of ambition? So many people are now worried that climate change is really becoming such a big issue that we are running out of the window of opportunity and of the time to act on it effectively. And the more we shorten this window of opportunity, the more we need to think of actions that are really ambitious and really transformative. And if you think about the funding calls that are coming out lately, many funders are looking for really transformative solutions for transformative action. But what does that transformative mean? So there's a whole body of literature on what is transformation and what transformative action means and what it means for climate change and other environmental changes, and different ways of sort of conceptualizing and defining it. And here you can see some of the quotes. So some people focus on defining transformation, that it's essentially about the speed and the scale of impact that the action would be producing. Others are talking about transforming the whole kind of system. So targeting not just, restructuring the way how things operate, restructuring the way how things are linked in the society, how they're designed, restructuring functions. So it's changes about the whole kind of quality of the system that's behind a problem. So it's more kind of deeper change, more systemic change, rather than just a tweak to the existing way of operating. And others are talking, well, again, just emphasizing that it's not just about a change in one sector or at one scale, but it's kind of crossing multiple sectors, crossing multiple scales, and is kind of whole system change, whole system wide. And I'll come back to the previous slide. So here you have like a diagram from actually one of the ministries in New Zealand that's talking about what's transformative change for the economy, because you can transform all sorts of things. This diagram comes from like a systems theory, systems thinking kind of tradition. So you would destabilize the system, you'd create a state of chaos, and then you wait for some sort of a breakdown in the system, and you create something new. So it's about this kind of a destruction and reconstruction process that you need to first kind of break what's already there to create something new and something that's better. And your first reading was also talking about the different challenges to planetary health. So that comes from the Rockefeller Foundation and the Lancet Commission report. And they've outlined what are the challenges to actually develop planetary health solutions. And you can see that there's imagination challenge, which is about, just changing the conceptual thinking about problems, that we need to, for example, use different metrics. We shouldn't be using GDP, which is missing out a lot of issues about the environmental change and various social metrics. We should also be sort of thinking about how to incorporate all sorts of externalities that we're generating. Another challenge is the knowledge challenge. So we don't know many kind of knowledge, well, there are many knowledge gaps that we need to address essentially. And the third challenge is implementation challenge. So how do we actually implement solutions on the ground? How do we create the stakeholder buy-in, government policy buy-in, and make sure that things get scaled up? And of course, when we are developing solutions such as adaptation and mitigation, we need to be innovative and create new ideas, new methods, and use a new way of thinking. And here you have the quote from Albert Einstein that we can't solve the problems that we created with the same type of thinking we used when we created them. So it's very much about trying to think in a different way. And one useful way of doing innovation that Jeffrey Sachs recommended in one of the lectures I attended was you look at a field or a discipline that's not your own, and you think, well, how did they solve similar comparable problems to what I'm facing in my area? And think about how do you apply what they did in their area to my area? And that's one of very kind of low-hanging fruits about going about innovation. Another way of innovating would be to use systems thinking. So we've talked about this way of considering the whole system, its interactions, thinking in a circular rather than linear way, not thinking in silos, but sort of coming together across disciplines, coming together across sectors, and creating solutions that cross boundaries of sectors and disciplines, but also seeing the whole as opposed to just parts, synthesizing rather than just doing analysis, and looking for relationships and connections between different elements, different phenomena, rather than thinking about them in isolation. So systems thinking is an approach that can be very helpful to develop innovation, but also think of successful adaptation mitigation strategies and develop solutions that create more synergies, overcome trade-offs, and are more sustainable and effective. And another approach is transdisciplinary collaboration. So many of the problems that we're facing with environmental change is not something that we can solve within the area of one discipline. And it's not something that we can solve within one sector. So we need to come across different sectors, we need to come across disciplines and work together. And you may have heard these buzzwords: interdisciplinary, multidisciplinary, cross-disciplinary, and transdisciplinary. And they are, in fact, a bit different. And you have to be a bit careful about how you use them, especially in funding applications, because people do assess how well and how correctly you use these terms and how well you've conceived your research project according to these different approaches. So first is the intradisciplinary, so where you are just sort of working within your discipline with experts in that discipline and you're not really collaborating with anyone. Then you have a multidisciplinary approach where you, let's say, have a project where you have experts in food science, for example, in agriculture, in engineering, in climatology, and they're all doing something that's related to the topic of the project, but they're just working independently, working separately, maybe sharing some results, sort of learning from each other, but they aren't really producing anything together. Then cross-disciplinary is more when people are trying to solve the problem from different perspectives, and they create solutions from these different perspectives. They learn something from each other, they create some connections, and perhaps some of the solutions are kind of crossing the boundaries of different disciplines. And then interdisciplinary is when you actually cross these boundaries completely and you create a solution that that requires that brings something from each discipline and isn't discipline specific. But it's kind of the same solution, but it takes into account aspects of different disciplines. And then there is transdisciplinary, where you have even greater level of integration. So you integrate the perspectives and you pay attention to that integration aspect in the process and the mechanism. So you need to be very clear about how you are integrating the knowledge of different disciplines together. And often another characteristic of transdisciplinarity is that you're not just working with the different disciplines, but you're also bringing in stakeholders from different sectors together. So it's no longer just an academic exercise, but it also brings in practitioners. So that's where we've got to with mitigation and adaptation. After, I'm going to explain you the assignment for the next session, but let's stop now for any questions.